programs. And so I'm here this morning to show you our new TeleNeurology Cart, which has been updated. The last one we had was 5 years old, so this is wonderful. And it's a great little cart. It's totally automatic. If you ever have a consult for teleneurology and they request a video for your patient, this cart will come from Pingree 4. If you need help with the cart, Pingree 4 knows how to operate it and can help you out. And if they're unavailable, our go-to floor always is the Fippins, because they take a lot of our neuro patients. So they're very experienced in doing video consults. What's great about this cart is there's nothing you do except plug it in.
Oh, good.
The physician will make arrangements with the staff of what time you'll call the machine, so it's kind of like FaceTime. So if they say, well, we'll do the video at 11, just make sure the machine's in the room. The nurse has to be in the room. The physician is encouraged to be there, but not always. But we find many times the physicians like to be there because they're actually ordering the consult, so they want to know what the neurologist sees and what the discussions are between the patient and the neurologist. Once the time is set, the machine is in the room, and the neurologist from NGH will just dial into the cart and he'll appear on the screen, very much like FaceTime. The technology with regards to the computer and the video and the audio has all been updated. So it's better than what it was before, and before it was really great. So on these machines we have our audio here, and then we have our camera up here. All you have to do is take this off. It doesn't work at all because I've tried it leaving this on. It's really fuzzy over there. What are you doing? So, and the camera again is really high quality. They can actually zoom in to actually look at the patient's pupils to do a pupil exam, which is really great. As far as what the nurse might be responsible for, we have a teleneurology reference book at the cart, and I have, at the station somewhere. I have updates for the book, so everything's been updated when the cards came in, so all this information will be in the book also. But, what was I gonna say? Lost my train of thought when I remembered to tell you about the books. It'll come back to me.
Nurse needs to be in the room.
What? Oh, yes, so, the nurse's responsibility, the nurse's responsibility is just to assist the physician if they have any questions. So, if there's a question about the patient's history or prior functioning level, the nurse will be able to answer it. As far as helping out with the exam, they might ask you to do specific things. We know that lots of times strength is something they ask you to help out with. So if they ask the patient to lift up their arm and hold it up, and they're not, the patient's kind of confused and isn't sure, you might have to assist them to get the arm up and then see what happens. And the same with sensation. They might ask you to, touch both sides of the patient's upper arms or lower arms to see what the patient's response is. Don't worry about not knowing the proper way to do anything. If they don't get the information they want, they are very good at saying, I need more information, or I need this to be done a little bit differently, and they walk you through it. Also on these exams, the doctors are very good. If you have any questions, you can ask questions, and it's very interactive, and they're great. They love teaching. So don't hesitate to ask, and if the patients or families want to ask questions, this is what it's for also. It's not just for, a doctor-to-doctor consult. Encourage them to be interactive with the physicians there. When you get the machine, we only ask you to make sure it's plugged in if you can. I don't know if you know, but the old issue with the carts was the cord was like spirally and it would tend to like be difficult to keep it plugged in. They eliminated that problem now, so you can, you know, you have pretty wide range to plug in the machine. The only time you would have to unplug it if they wanted to watch their gait. So you would unplug it, you'd probably have to have someone walk with the patient and then have someone push the cart so they could actually see what the patient's gait looked like. And I know lots of times that's one of the reasons that video exams are done, because patients have some kind of abnormal gait that might be neurological and they want to assess that. Let's see. There's absolutely nothing you have to do. This looks like a touch screen. You have different buttons here, but there is nothing you can do with the machine. Obviously, it won't let me do anything. And I have the codes to the machine, so you can't do anything to, you know, mess up the video with the machine. And the only ones who have access to call in are the neurologists. So if a doctor appears on the screen, it's going to be the right doctor. There should never be any confusion about, you know, who is this appearing on the screen. If we've had instances where they've either called in early or the machine has been set up and the nurse hasn't been able to get in the room, and the doctor's like, hello, I'm here, is anybody over there? So if anybody's walking by the machine that's set up for video and they see a doctor on there, just respond and, you know, get whomever you need to help out with the exam. It's not some random stranger who hacked into the system. Okay? Any questions about the machine? All right.
You won't know until we're doing it.
I know.
Yeah.
Yeah.
So where is, so there's just one machine in the hospital?
No, we actually have 6 machines in the
okay.
hospital. So we have 2 in the ED,
Yeah.
1 in the ICU. This one's from Pingree, and that's probably the one you're gonna use the most. There's 1 in the Fippins and 1 in Debbie. So, unless Fippins is in use for an emergency, you'll get the Pingree. If Pingree 4 is in an emergency use, you'll get like the Fippins one. If you ever have a rapid response or a telestroke and they want the video, you can always call another unit and ask them to bring it, and they'll bring it here for you. Pingree 4 would probably be the best option. Just call up, say we have an emergency, we need the TeleNeuro machine, they can bring it over for you. Rapid Response is very well versed on using this machine and all the policies and processes that go along with TeleNeuro, so use them as your resource. And I'm telling everybody that, and I've told all the Rapids that, I'm telling everybody, you're their resource, so make sure you know some of the basic answers, and they laugh about it, and they're like, yeah, of course we know that, Eileen, you know. Any other questions?
Is this the same as what we had at Union, or is it a newer?
It's the
version?
updated cart,
Updated.
so it's replacing the one you had at Union.
Yeah.
Yep. So the one you had at Union, we have throughout the hospital here, also the exact same machine. Now those are all gone, and these are the newer ones. Those were 5 years old.
Yeah, 11.
So. Okay.
So what happened to neurologists? We used to have neurologists who actually came